That morning dizziness when you stand up is not just aging. It could mean your brain is losing blood flow every time you get out of bed. Most people ignore it until it leads to a fall, a fracture, or a stroke. What actually happens inside your body during that dizzy moment is alarming. I am a physician, and today I will show you exactly why this happens. There are 5 warning signs that separate harmless dizziness from a real emergency. If you or someone you love is over 60, this video matters. Stay until the end, because the last warning sign is the one everyone misses.
Today we are going to discuss why that brief dizzy spell you feel every morning might be your body sending a distress signal you cannot afford to ignore. In this session, we will walk through what happens inside your blood vessels, your heart, and your brain the moment you stand up from bed. Every single morning, millions of older adults swing their legs off the mattress, stand up, and feel the world tilt sideways for a few seconds. Most people grab the nightstand, wait for the moment to pass, and never mention it to their doctor. But here is what nobody tells you. That brief dizzy moment may be a condition called orthostatic hypotension, and it is far more common than you think. Studies show that nearly 1 in 4 adults over 65 experience a significant blood pressure drop every time they rise from a lying or sitting position.
Pay close attention, because this is the exact mechanism that puts your brain at risk.
Now let me explain exactly what is happening inside your body during those few seconds of dizziness. When you are lying flat in bed, your blood is evenly distributed throughout your body, flowing smoothly from your heart to your brain and back again. The moment you stand up, gravity immediately pulls between 500 and 1,000 milliliters of blood downward into your legs, pelvis, and abdomen. That is nearly a full liter of blood suddenly rushing away from your brain and pooling in your lower body within seconds. This sudden drop in blood flow means your brain is temporarily starved of the oxygen it needs to keep you conscious and balanced. In a healthy, younger body, special sensors called baroreceptors in your neck and chest detect this drop instantly. These baroreceptors send an emergency signal to your brain that says, speed up the heart and tighten the blood vessels right now. Your heart rate increases, your blood vessels constrict, and within 1 or 2 seconds, your blood pressure stabilizes and you feel perfectly fine.
Everything I just described works in a younger body, but aging changes it all.
But here is where age changes everything. As you get older, those baroreceptor sensors become slower and less sensitive, partly because your arteries stiffen with age. When the sensors are sluggish, the emergency signal to your heart arrives late, sometimes 3, 5, or even 10 seconds too late. During that delay, your brain is sitting in a state of reduced oxygen, and that is the exact moment you feel the room spinning. This is not just an inconvenience. This is your brain waving a red flag that its blood supply was just interrupted.
Not every dizzy moment is dangerous, and here is how to tell the difference.
Now I want you to understand the difference between the harmless version and the dangerous version of this dizziness. If you stand up quickly, feel a brief 1 or 2 second lightheadedness, and it clears immediately, that is usually a mild and temporary response. It can happen to anyone, even younger adults, especially after a long night of sleep when your body has been horizontal for hours. Dehydration from not drinking enough water the previous evening is one of the most common triggers for this mild type. But when the dizziness lasts longer than a few seconds, when your vision goes gray or black, or when you feel like you might collapse, that is a completely different situation. That prolonged dizziness tells us that your blood pressure dropped by more than 20 points systolic, and your body could not recover fast enough. And this is where the real danger begins.
The consequences of ignoring this go far beyond just feeling dizzy.
The number one injury risk for adults over 65 is falling, and orthostatic hypotension is one of the leading hidden causes. Research has shown that older adults with this condition have a significantly higher risk of hip fractures, head injuries, and hospitalization from falls. A single fall in your 70s or 80s can change your entire life, taking away your independence and your confidence in just one moment. But falls are not the only risk hiding inside this condition. Studies have found that chronic orthostatic hypotension is linked to a higher risk of heart attack, stroke, and even cognitive decline over time. When your brain repeatedly experiences those brief drops in oxygen every morning, the damage can quietly accumulate over months and years. Researchers have discovered that people with persistent orthostatic hypotension show increased white matter damage on brain scans, which is associated with memory loss and dementia. This means the dizziness you dismiss as no big deal could be silently accelerating brain aging every single day.
Here are 5 warning signs that mean it is time to see your doctor.
Now let us talk about the specific warning signs that tell you this is no longer harmless. The first warning sign is frequency. If you are feeling dizzy every morning or multiple times a day when you stand, that pattern matters. Occasional dizziness once every few weeks may be nothing, but daily episodes are a clear signal your blood pressure regulation is struggling. The second warning sign is duration. If the dizzy spell lasts more than 5 to 10 seconds, or if it takes more than a minute to feel stable, that is significant. The third warning sign is vision changes. If your eyesight goes dark, gray, blurry, or you see spots when you stand up, your brain is not getting enough blood. The fourth warning sign is near fainting or actual fainting. Even a single episode of losing consciousness after standing demands medical evaluation. And the fifth warning sign, the one most people miss, is a feeling of extreme fatigue or confusion after standing that you cannot explain. Some people never feel traditional dizziness. Instead, they just feel suddenly weak, foggy, or mentally slow after getting up, and that is the same mechanism at work.
The morning is the single most dangerous time of day for this condition.
Now I want to explain why mornings are especially dangerous for this condition. While you sleep, your body enters a state of low blood pressure and low heart rate because your muscles are relaxed and your body does not need to fight gravity. During the night, your kidneys continue filtering your blood, and you lose fluid through breathing and sweating, even if you do not realize it. By the time you wake up, you are naturally in a mildly dehydrated state, with lower blood volume than you had when you went to bed. So when you swing your legs over the side of the bed and stand up, your blood volume is already low. Your heart rate is still in sleep mode, and gravity hits you all at once. This is why the very first time you stand in the morning is statistically the most dangerous moment for a blood pressure drop. Many of the worst falls in seniors happen between the bed and the bathroom in the first 5 minutes of waking up. There is another factor that makes morning dizziness worse, and it is something almost no one considers.
This next factor could be sitting right on your nightstand and making it worse.
If you take blood pressure medication, many of those drugs are designed to lower your blood pressure, which is exactly what they should do. But if your medication peaks in the morning, or you take a dose right before bed, the blood pressure lowering effect may be strongest right when you stand up. This creates a perfect storm where medication, dehydration, gravity, and aging baroreceptors all combine at the same moment. I am not telling you to stop your medication. That would be dangerous. But I am telling you to talk to your doctor about the timing. Certain blood pressure medications like alpha blockers, calcium channel blockers, and diuretics are more likely to contribute to morning dizziness. Beta blockers can also slow down your heart rate response, making it harder for your body to compensate when you stand. Antidepressants, especially tricyclics and certain SSRIs, are another category that can significantly worsen orthostatic hypotension. This is why a thorough medication review with your physician is one of the most important steps you can take.
Now, here are the exact steps to protect yourself starting tomorrow morning.
Now let me share the practical steps that can dramatically reduce your morning dizziness and protect you from falls. The first and simplest step is hydration. Drink a full glass of water before you even get out of bed in the morning. Research shows that drinking about 500 milliliters of water can raise your blood pressure within minutes by activating your sympathetic nervous system. While you are sitting, pump your ankles up and down and clench your calf muscles to push pooled blood back up toward your heart. This simple leg pumping exercise acts like a second heart in your lower body, squeezing blood upward through your veins. After 30 seconds of sitting and pumping, slowly stand while holding on to something stable, like the headboard or a sturdy nightstand. The third step is to avoid hot showers immediately after waking up, because heat causes your blood vessels to open wider, which drops your blood pressure even further. If you love a warm morning shower, start with lukewarm water and keep the bathroom door open so steam does not build up. The fourth step involves your meals. Eating large, heavy meals, especially ones high in carbohydrates, can cause a condition called postprandial hypotension. After a large meal, blood rushes to your stomach and intestines to help with digestion, pulling even more blood away from your brain. Eating smaller, more frequent meals throughout the day, instead of 2 or 3 large ones, can help keep your blood pressure more stable. The fifth step is salt intake, and this may surprise you because we are often told to reduce salt. For people with orthostatic hypotension, slightly increasing salt in the diet can help your body retain fluid and maintain blood volume. However, this must be done under your doctor's supervision because too much salt can raise your lying down blood pressure to dangerous levels. The sixth step is compression stockings, which are special tight socks or leg garments that prevent blood from pooling in your lower legs. Studies show that waist-high compression garments are more effective than knee-high ones because they also compress the abdominal blood vessels. The seventh step is safe physical exercise because gentle, regular activity strengthens your heart and improves your blood vessel flexibility. Walking, swimming, stationary cycling, and chair exercises can all help your circulatory system respond faster when you change position. The key is to avoid exercises that require sudden position changes, like quickly bending down and standing up, which can trigger dizziness.
This advice should be given to every patient over 60, but rarely is.
Now, here is something critical that we do not tell patients often enough. If you experience morning dizziness regularly, you should ask your doctor for a lying and standing blood pressure test at your next visit. This simple test takes only a few minutes. The doctor checks your blood pressure while you are lying down, and then again after you have been standing for 1 and 3 minutes. If your systolic blood pressure drops more than 20 points, or your diastolic drops more than 10 points, you meet the clinical definition for orthostatic hypotension. You can also monitor this at home with a basic blood pressure cuff by following the same lying and standing method. Write down your readings and bring them to your next appointment so your doctor can see the pattern over time. There is one more danger window I want to warn you about, and that is standing up after a long period of sitting. Many seniors sit for extended periods watching television, reading, or during long car rides, and the blood pooling effect happens in those situations too. Anytime you have been seated for more than 30 minutes, use the same slow rise technique with ankle pumping before you stand. Also, be extra cautious after naps because your body goes through the same blood pressure drop as it does after a full night of sleep. Nighttime bathroom trips are another extremely high-risk moment because you are moving from deep sleep to standing in a dark room while half awake. Always use a nightlight in the bedroom and hallway, and sit on the edge of the bed before standing, even in the middle of the night.
Not all dizziness comes from blood pressure, and you need to know the difference.
Let me also explain when dizziness has nothing to do with blood pressure and comes from a completely different source. A condition called benign paroxysmal positional vertigo, or BPPV, causes intense spinning dizziness when you turn your head or roll over in bed. BPPV is caused by tiny calcium crystals in your inner ear that become dislodged and send false signals to your brain about your position. The key difference is that BPPV dizziness is triggered by head movement, not by standing up, and it feels like true spinning rather than lightheadedness. If your dizziness happens when you turn your head to the side, look up, or roll over in bed, that points more toward an inner ear problem than blood pressure. BPPV is very treatable with a simple repositioning maneuver that your doctor or a physical therapist can perform in minutes. Another possible cause of dizziness in seniors is cardiac arrhythmia, where your heart beats irregularly and cannot maintain steady blood flow to the brain. If your dizziness comes with heart palpitations, chest tightness, or shortness of breath, that combination requires urgent medical evaluation. The bottom line is this: not all dizziness is the same, and figuring out the type you have is the first step to protecting yourself.
Here is a simple 5-step morning routine that could save your life.
I want to leave you with a simple morning routine that can protect you starting tomorrow. Step 1. Wake up and drink a full glass of water while still in bed. Step 2. Sit on the edge of the bed for 30 seconds and pump your ankles 10 times. Step 3. Stand up slowly while holding on to something sturdy and wait another 15 seconds before walking. Step 4. Walk to the bathroom slowly and avoid any sudden bending or reaching overhead. Step 5. Use lukewarm water if showering and sit on a shower chair if you have ever felt unsteady in the shower. These 5 steps take less than 2 minutes, but they could be the difference between a safe morning and a life-changing fall.
If this video helped you understand something you were ignoring, do one thing for me.
Please share this video with someone you love who is over 60, because this information could genuinely save a life. If you found this helpful, subscribe to this channel because every week we cover the hidden health warnings that matter most for your age. Take care of your body, listen to its signals, and never ignore what it is trying to tell you.